All right, so we are going to do a progression to really help loosen up your hips, and specifically if you get crampy or pinchy around your hips and it's tough for you to kind of sit on the floor comfortably in, say, this position. So if you've seen this 90-90 position, it is good to gain some hip mobility, but not everyone can start there. So I actually with the order of kind of how we want to progress is we actually want to be able to somewhat sit with our butt bones on the ground and our legs out in front of us. Now, you don't have to be perfectly upright. Actually, I prefer you to slouch a little bit. So just resting your hands on your kneecaps is a good position to start in. And then just take a nice deep breath in and out. And again, I don't mind if that back is rounded. We're not trying to intentionally stretch the hamstrings here. We're trying to get you more mobility in your hips. So that has a lot to do with the position your hips are in. I actually don't want you to roll forward. Okay, so we're just sitting here nice and comfortable. And the first thing that you're going to do, you can flex your feet up just a little bit or just use these kneecaps here that your hands are on. And all you're going to do is roll out and then roll in. Get yourself a little bit of space. So you can do them both the same, out and in, or you can do what I call windshield wipers, back and forth. This is the first thing to kind of get your hips used to this internal and external rotation, which is that 90-90 sitting or shin box sitting that we often hear about. So I'm just kind of rotating my feet back and forth. Okay. And kind of give yourself grace. We're just trying to get mobility. And so we're not really trying too hard, but you can stay in that position. Take a breath or two. Make sure you're not swinging side to side up here. And you're just keeping your butt bones nice and solid on the ground. Okay. So from there, what we would introduce is you can actually sit back a little bit and actually, again, continue to let your back round. And we can do windshield wipers in this position, back and forth. Loosen up your hips. A lot of the time, what we're going for is more of the knees going off to the right side and not being comfortable. That is usually more pinchy for the hips than this other direction. And we'll talk about that in just a minute. So back and forth like this. It's another progression. Now what you can do is you can decide to swipe your legs to one side. I am going to go off to my left. So I'm leaning onto my right hand because this is the side that we normally want to work on. It's normally more of the restricted side because of the asymmetries that's in our body. Okay. And so there's lots of options here. If if it's obviously tough to sit up like I'm doing, you can lean here, you can lean on an elbow, but the goal being you're getting as upright, progressing as possible. And that means your hips are opening up. Now, if you're starting on the elbow, what I want you to think about is I want you to think about kind of making sure you're not holding a lot of tension and pressing that elbow in. Just kind of lean into that elbow. And you're just going to try to find your back, your left knee down to the ground. And maybe you can do some press. Maybe you start to feel your inner thigh, and that's a good thing. That muscle will help you. You can see how that then pops my right knee up. So I have a little tension. I'm going to put a prop here, and I have a little bit more leverage up on my hand now. I had to prop under my right knee because that started to pop up. If I want to be working on pressing both knees down, which is really helping me get mobility, I need something under this right knee because I've got no leverage when it's free like this. I can try, but I'm not really pushing against anything. Okay. So as I press both knees, my belly button starts to actually turn left, and that's good. Or I guess square up in this case, because if not, I'm left turned toward my right arm, kind of my chest going toward this right arm. We want to be able to square up. So you might be able to kind of play with it a little bit. If you press both knees down at the same time, it's going to turn your hips, and that's the mobility that we want. It's coming from the pelvis, which is the socket for your hip joint. So if you want more hip mobility, you need to be able to be in control of that pelvis and be conscious of it. Okay? So you can kind of work that. So don't shy away from propping up with pillows. You can prop under either knee. wherever you feel the restriction. You can actually sink in to this right arm. Again, this right side tends to be the one that's more restricted. So I usually sit here, I'll press, turn my hips just a bit, and then take a couple deep breaths into this sticky right side. You might notice that when you breathe in, you've got some tension along through your ribs right here under your armpit, and that's an important muscle that we're trying to release. It has a lot of pull and leverage on your pelvis, and so you don't want it to pull asymmetrically. All right, so for the sake of fun, we're going to go ahead and switch. So we're swinging our legs to the right and leaning into our left hand. And so you might find this is easier, okay? And if this is easier, that is somewhat normal because of the asymmetries in your body, okay? If this is easier, I would still practice it, okay? But really, legs swung to the left, leaning into the right hand is where you're going to practice your breathing, and you're going to do some holds, and that's where you need to gain some mobility. Specifically, again, the mobility to be able to turn your belly button. If you take your hand right on your belly button or lower belly, turning it left by pressing your knees into the ground. You'll find potentially that for most of the people that I work with, it's real easy to do that on this side. Okay. So you can start to incorporate some of these things easily when you're sitting on the floor. I highly recommend movement on the floor. If you like to sit on the floor, or even if you don't, it's a good habit to start to build. So you can, instead of, always sitting on one side, we're switching to the other side. Now, I will make a quick note. If you sit on the floor Indian style, you just saw me do it. I always prefer my right leg in front. There is a rhyme and a reason for that. It is the asymmetry of my body. So I do try to then switch and put my left leg in front. Essentially what it does is it tips me slightly onto my left side. And so it allows my body that sense of that left side, which is super important. All right. So work with that. You can work at any level. Again, sitting legs straight is really, really powerful. And we're not trying to kind of come up and have too much of that military posture. And you're just kind of working through, keeping your breath and keeping it really simple as you progress through that.